fully agree with, there's something Busi said about, who do we now use, like, who do we now use to deliver the message, right? And to get messages through. And, is it the standard, is it the doctor? Is it the nurse? Is it the, the authoritative figure, whoever that authoritative figure is, that we use to either deliver the news or to advocate on our behalf. And yes, we've seen that has changed significantly, and we've seen that communities have come to trust the person that they see trust and see living in their same circumstance, and is going through sort of the same experience that they're going through, right? So just as that person is the information holder, if you will, that person is also trusted to be the voice, the one who will now take our needs and our concerns and present it to, whoever the masses are or whoever the decision makers are. We did a visit to Kwale County here in Kenya, and went as far as almost the border with Tanzania and visited a health clinic there. But then our visit was really with the community leader and some of the community health workers and some of the persons who were considered influencers in that community. And one of the things that they were doing as a community that really struck me was that they have these community scorecards, which are it's prepared by the government, but then they use the community scorecards to rate the clinic, right? So they go into the community to household level, they gather information. That information is gathered, aggregated by whoever is selected as the lead community health worker. Then they come back and there's a meeting. So when we were there, we happened upon the meeting at the clinic with, the lead consultant, the nurse, the administration, all sitting around, and this person then saying, here's what the community thinks of the services provided by this clinic. And here's what we think of safety. We think of cleanliness, bedside manners. Here's what we think the clinic needs to work on for, services that we seek at the clinic, for outreach services, your relationship with the wider community, etc. So you see in that example, not only does it show, the need for this feedback loop when we talk about advocacy, but it's also that advocacy doesn't have to be this really grandiose thing. It's advocacy at that level because this lead community health worker and the community, the community leader / chief is entrusted by the community to be their voice and to advocate for them in front of the clinic lead, the administration, etc., to say, the fence is broken, so we don't feel safe. The last time we came and it was raining, the roof was leaking as, I had my consultation. So what is it that we can do? We noticed the last time there was a pile of rubbish. This can lead to XYZ. We noticed the toilets were not working, or we noticed this particular nurse is just really great. We love her bedside manners, and so on and so forth. So that advocacy, and I liked what the report said about advocacy for the truth. That trust in who advocates for you is important on so many levels. So it can be the community leader, it can be civil society organizations, but the community gets to decide who that advocator, if you will, or that advocate is for them.